morning, Spotlight viewers. I am Dr. Mini, Obstetrician and Gynaecologist. So today I would like to mention a few points about the perimenopausal problems which common women face. So perimenopause, it sets in around 3 to 4 years before the menopause sets in. It depends on different patients. It may vary from 40 years, 42 for some. Some patients even experience it even at the age of around 35, 36 also. And the intensity also varies. Some patients, it's like a rocky road to menopause. Some patients have a smooth sail also. So it's not that everybody suffers from the perimenopausal problems. But when there is a problem, when you have to approach a doctor is what I'm going to mainly explain today. So perimenopause is just a transition from the before menopause to the menopausal stage. It's called as menopausal transition. Mainly occurs because there is a sudden decrease in the estrogen hormone. So most of the symptoms which are manifested are also because of this hormone decrease. So many physical and emotional changes and symptoms which occur because of this perimenopause. But patients tend to perceive it as a disease. It's not a disease, it's a natural change. The most common symptom where the patients come to us is with irregular cycles. So the irregular periods can range from either prolonged menstruation for many days, heavy bleeding. Sometimes they may not have periods for 6 months and then they start bleeding. Some people have reduced cycle and spotting in between. These are all the complaints that they have. So whenever you have a scanty bleeding or prolonged period like 4 months you don't have a cycle, you don't have to panic or get worried. You don't have to meet a doctor also. That is a normal thing. Only when you're bleeding for heavily bleeding for many days, prolonged more than 10 days, 12 days, and that's repeating every 2 months or 3 months, then you need to seek a medical advice. So that is the most common problem. The next thing which we see mostly is hot flushes. Patients feel very hot, sweating, and especially at night they have night sweats. So this is also caused because of estrogen withdrawal, sudden withdrawal. So this causes sleep disturbances. So patients are not able to have good sleep at night. So that results in mood swings, irritability, depression. The other symptoms which you commonly see in postmenopausal group is joint pains, because the calcium in the bones reduces and they manifest with several bones and joint pains. Then vaginal dryness is present and increased weight gain is also there, loss of hair, and urinary symptoms like there's a symptom called stress incontinence where the patients, when suddenly they laugh or they climb stairs, there is dribbling of urine. It's not under their control. And even there is a term called as urgency to pass urine, that is urge incontinence. So these are the common manifestations or symptoms which the people face. And the other thing coming to perimenopausal is regular thorough examination of breast is a must, because it is then this period that we find there are some lumps in the breast, and that may be a benign which is not cancerous, or it could be a cancerous lesion. So for diagnosing that, a thorough examination of breast, self-examination every month is more than enough, and once in 6 months visit a doctor. And pelvic examination for a pap smear is also must during perimenopausal age group also. It starts in the reproductive age group, but please continue that also. And breast screening and pap smear pelvic examination as well. And coming to preventive health care, it plays a major role in perimenopause. So most of these symptoms, it can be reduced. It cannot be eliminated completely, but it can be reduced with the help of lifestyle modifications. So some yoga, exercise, regular exercise, good diet, maintain healthy weight, walking, all this can help you come out of these symptoms very smoothly. If still it is not getting controlled, then definitely we will opt for the next line of medication, that is hormonal therapy. So that's it about the perimenopause.